There are a lot of different vitamins and vitamin brands out there. So I kind of like to kind of give you a scoop about some of them. And there's difference in them. So one of the things we carry here at the office that's a little bit unique that you don't find everywhere is called a liposomal vitamin. And I explain to people the difference is most vitamins like this vitamin D and like this magnesium here, we orally take it and it could be a good quality vitamin, but it has to go through our digestive tract. So the problem is if our digestive tract is at all disrupted, we don't always absorb things like we should. So another way of people get vitamins, and it's becoming more and more common, is you hear about people getting the B12 injection or a vitamin C injection. And that literally is where they're literally injecting into a vein the vitamin directly into the bloodstream. That way it bypasses the digestive system and they get a really high dose of it all at once. Well, a liposomal fits kind of in between there. So our normal vitamins, I would say, are at this level. Your injections are going to be way up here as far as potencies, and your liposomals are going to be just below that. And the reason is think of your vitamin with this nice little lipid package around it. So when we ingest it, it bypasses digestive system and goes right into the bloodstream. But the beauty behind taking a liposomal type of vitamin is that you don't have to go get an injection, and you can take it every day at a not so high dose, but yet still get it more bioavailable to the body, which means your body's more able to use it. One of my favorite ones that we have is the vitamin C. This has been a hot item in the office this winter. It is awesome to take as a preventative thing from all the sickness going around. One of my other favorite ones is this one called Restore. And some people are familiar with something called a Myers cocktail, which is basically an IV injection of a high dose vitamin C and B vitamins. Well, we have it in a nice form, in a liposomal form that we can actually take every day. This is a great product for people who are chronically ill. Maybe it's Lyme disease, they're cancer patients, some type of chronic illness that really helps with them. Vitamin D is also another great one that we all should be on. I often hear of people that are on 10,000 IUs of vitamin D. That is a lot of vitamin D. So anytime somebody's taking that much of a vitamin, we begin to wonder, is it an absorption problem or is it really the vitamin D problem? So this is a way to get that vitamin D in the body and make it more bioavailable. B vitamins, that is another thing. Like I said, we hear a lot of people getting these B12 injections now. So liposomal B is a way to be able to get it on a daily basis and not quite such a high dose. The other thing about B vitamins is I've had patients who have had the injections done before and they get really high blood levels of it. And what that usually tells us is the body's not processing. B vitamins need to be in the right form for your body to be able to use it. And so sometimes what's lacking in the body is something called glutathione. And glutathione is a major antioxidant. Most of us are deficient in it because of just stress in life. Others just don't make enough of it because of a genetic mutation called the MTHFR gene mutation. And that's a whole other complicated process that I won't get into. But what we find is some people, in order for them to utilize B vitamins, they actually need the glutathione along with it. So if you've had problems with B vitamins in the past, think about adding some glutathione to your diet, and it can really help with some of those issues.